I don't know if your guys like this, but page 20 through 23, kind of tucked in between the mowing is. Saw that. See that? I was waiting for the third one. Yeah. It's summary is on page 24.
Ready? We'll go ahead and call the meeting to order. Sorry for the slight delay there. First item will be roll call.
Mr. Ryan?
Here.
Mr. Fritz?
Here.
Mr. Ricky?
Here.
Mr. Layden?
Here.
Mr. Mann?
Here.
And Mr. Darius absence. Mr. Kirk is here. We have Jamie Lewin and Roy Nixon joining us by video chat, as well as Dr. Jefferson, the director of the officer.
Next item will be to approve the agenda. Take a motion to do that.
So moved.
Second. All in favor, say aye.
Aye.
All opposed, same sign. Have we read the previous meeting's minutes? If there are no additions or corrections, they'll stand approved as presented. Were there any public comments submitted?
There were none.
Okay. Report of officers, CFO report.
Okay, so I don't have a board packet in front of me, but I think Ryan sent me all the page numbers. So page 6 should be the bank balances as of March 19th. Yes. And any questions on any of that? Can you guys hear me?
Yes.
Yeah.
So page 7 then is the cash reserve analysis. Page 8 is the sales tax that we received in March. We were a lot closer to where we should be. We were only about $3 off of where we were last year. So who knows what that's going to be going forward, but that's where we were for March. We are on about a 2-month delay, so we may not see the dip until a couple of months. Any questions on the sales tax? Page 8 and 9 is the check register. Oh, sorry. Did somebody have a question?
Mr. Meehan had a
Why
question.
don't you, if it's okay, just go through them all and then I'll ask some questions.
Okay.
That'd be all right.
And then let's see, what page are we on? Page 10 is the bills that were approved by email last week. So those have been paid, but if there's any questions on any of those, that is, I believe, the end of this part of my report. Yes. So what was your question?
Yes, Mrs. Lubring, on page 6, just a general question. We got $2.1 million in the bank. and I've been away from it too long. I know that anything on deposit over or above the $250,000 secured limit has been secured by securities. And I'm wondering, are we following those securities and the value of those securities on a regular basis to make sure that we're completely insured?
Yeah, we get a report every month. I haven't seen one. Of course, today's only the 2nd. I haven't seen one yet for March. But we get one every month that shows us what that is. And they're bonds. They're mostly bonds, so.
Okay, so you feel comfortable that we're 100% insured here?
Yes, yeah, they actually usually insure us for $250,000 more than what we have in the bank.
Okay, all right. And on page 8, the year-to-date amounts of PCAD sales tax receipt under March, the 220 year-to-date, that'd be that 730,000, right?
On March for 2000, oh, I didn't pull that down. Yeah, 730,000. Yeah.
But it's 730. Okay, that's what that's what.
Any other questions?
Thank you.
Okay, that's the end of my report.
Thank you.
Chief's report.
All right. As you gentlemen are aware, we're been in the midst of the pandemic since about the last time we met. Pretty much right after we got home from the EMS day at the Capitol, everything kind of went sideways at that point. With that in mind, just on that one note, I did attach some general information to one of the packets you have. Should be right between on-duty screening, and it's the last few pages in there. And what those relate to, and this is information only for you gentlemen to peruse. This is how the Medicaid expansion affects us, specifically EMS in Missouri. Shows kind of breakdown of how it is in the states. And you'll see one of my little footnotes in there. Medicaid expansion will provide healthcare to more than 230,000 Missourians. Currently, right now, 35% of all private pay would be affected by that. So, significant increase in revenue would be seen by EMS if Medicaid expansion were to take place. The rest of that, there's all just some good notes in there. And I simply included that for you gentlemen as information. So, like I said, right after we got back from that, all this COVID-19 business started happening. So most of what I'm going to tell you tonight is cliff notes from that. Anything you write down on COVID-19 procedures is outdated by the next day right now, if not by the next hour. With that in mind, the task force, as some of you might be aware, hopefully everybody's getting that message via Nixle. If not, I've got the contact information for you. Just ask me after the meeting. I'll be glad to give you that contact info. The task force, as you know, has been set up with all of our area leaders from the county commission, the hospitals, EMS, fire, law. I know I'm leaving some out at this point. Joanne Martin is our section chief. She's basically in charge of operations. That is where, can you guys all hear me? Jamie, okay. We fall under operations under the incident command system, which you have an incident commander, and then you have different areas of that, all the way from logistics to finance and so forth. We're over here in operations. So our branch manager is Joanne Martin, which is the Betts County Health Center. And she's done an amazing job of coordinating efforts between all these different agencies. Right now, anybody who turns on the news, you can turn to 10 different channels and get 10 different stories. So she's trying to basically herd a lot of cats, and she's done an amazing job of doing that so far, as well as the rest of the task force kind of working together. EMS we were very involved. It kind of seems like I've been going from meeting to meeting ever since this started, but they all are worthwhile. At this time, the task force is only meeting on Mondays. If this starts to bloom,
we're looking at a peak in probably mid-May. Dr. Gustafson may want to elaborate on that on his report. But if this blooms, we want to be as prepared as possible. We have, in the Midwest, the good fortune of not living very close to each other. So it's been kind of slow to take off. We have a few cases here in the city. Some of them have been sent here to quarantine. I can't really speak to the testing because that's just not in my wheelhouse. That is Bothwell and the health department. As it stands right now, by this Friday, and I believe subsequent Fridays, they'll be able to put out very good numbers on our local local population that is affected by COVID, whether it's a self-imposed or work mandatory imposed isolation and or quarantine. Just so everybody here understands, if you hear those terms, quarantine means I'm going to separate myself from others, but I'm okay. Isolation means you're sick. So that it's not really semantics. There are two different words that mean two different things. But most of what we have right now, if not all of what we have, to my knowledge in Pettis County, is quarantined at home, meaning they're symptom-free, largely no real highly acute patients right now. They have relaxed some laws. Let's say the Department of Health and Senior Services throughout the state of Missouri, and along with the governor's cooperation, have relaxed some privacy laws that allow emergency services and emergency services only through dispatch to give us an address of a known quarantine patient. And that's simply to give us a heads up. It doesn't guarantee that we'll know going in, but it gives us a heads up, hopefully, so that we can go into that situation and not be ill prepared. With that in mind, you've probably read in the Democrat that we've been working very closely with the hospital and the fire department, as well as the other agencies. With the fire department, as their primary role is fire, they're city fire, but they're also our first responders for medical calls, car wrecks, things like that. We have kind of triaged some of those by those screening questions that everybody hears about. Have you traveled? Do you have a sore throat, body aches, cough, fever, sometimes GI symptoms? Basically, there's a large list of screening questions that's asked, and what we're trying to do is keep the fire department off of those scenes where we don't need them. They are available if we do need them. Say we've got somebody we need extrication or egress out of the house, we'll actually pluck however many we need out of their crew, but instead of taking the risk of exposing all those people, that's what we're doing with fire. In keeping with that, one of the major tasks of this task force, the one that we really focus on in the healthcare end of things, is protecting our local resources. And the number one on that list is our hospital. We have to keep the hospital open, we have to keep it functioning. So we've been working at ways to mitigate that, all the way from giving out information to people who don't need to go to the hospital, to early arrival instructions, to coordination of procedures, into the nitty gritty. I mean, this is a daily thing. I literally just got back from the hospital before this meeting today, working with one of the people over there to try and keep us completely out of the emergency room to where we can do a patient handoff in a separate area, so we're not traipsing through them. One of the terms you may hear in the news right now is viral shedding. I still can't say it. Viral shedding. And what that is just like what it sounds like. You've got stuff falling off of you. So EMS, having gone into people's houses, having been out in the public, having just the nature of our job makes us a high-risk person to be around. So I appreciate the social distancing and the ability to do this tonight, as well as any other meetings you gentlemen might be on right now. It's really important. I don't want to say we're toxic or anything, but it's a good idea to stay away from us if you can. Besides that, I've got some information on the building. We blocked up the windows. Ryan and I and a couple other people actually knocked out the window. They came in and blocked up it. So we're ready. We're going to do a little bit of painting and priming before they put the switch in. But we're largely ready for them to start on that. I believe that's going to happen next week. We've been looking at ways to prevent infection. A lot of this, you probably heard before, a lot of this has been eye-opening for our healthcare system in the United States, and it's true that we are woefully unprepared. However, if there's a silver lining, which I like to see a silver lining, is that we're learning a lot of things that we could do better in the future. And one of those things that I think PCAD can do better in the future is limiting people coming to work in uniform and leaving in uniform. That should not be happening. And about the only way for that to happen is just to maybe look at getting an extra washer and dryer so that we can have them not only putting their uniforms on at work, but leaving them here, washing them here, and not taking them home to their families. And just the significance to this, about 20% of New York's EMS staff is out sick right now. So that's 1 out of 5 out of all of their EMS workers, paramedics, EMTs, and that includes fire department base. About 20% of them are already out sick. So the last thing we want to do is give that, expand that, or take them home, or take it home to their families. So, EMS workers in New York are even in that area, which, as we know, is very, very profoundly affected by this right now. EMS workers are actually sleeping in their cars just to keep from taking them home to their families. So I think that would be a good purchase for us. It wouldn't be a whole lot of money, and it would basically, if you look at what it costs to buy a new washer and dryer for that station, it would cost less than one person's paycheck if they had to be quarantined for 14 days. So just a way to kind of look at the cost benefit of that. I know that probably ought to fall under new business, so I'm just showing you right now as a hypothetical. Our PCAD procedures have changed just dramatically. We've put a few of the notices out via the task force, via our webpage. You've seen the notices that we've shut the building down for any kind of public traffic whatsoever. So if you come, we're going to meet you at the door at best. Trying to keep that as minimal as exposure as minimal as possible. We are looking at some decontamination units for the trucks. Many years ago, I say many, PCAD hasn't been around many years yet, but about 5 to 6 years ago, PCAD purchased some ultraviolet lights that were to be put in the trucks, and they worked okay, but light doesn't go around corners, and they had their drawbacks, and the ones we bought were kind of poorly built. The circuit boards were upside down, so when the thing got hot, the solder would melt and the components would fall out of them. So we've been looking at better options for that, and that's again another silver lining is we're finding a lot of alternate means of decontaminating our stations, our trucks, our people. One of the DIY methods, just for instance, is actually taking the cut guns like a painter uses and putting the chemical in there and actually spraying, fogging the truck out, and it works really well. So we're looking at some units that actually do that for a commercial point. They can decon a truck in a matter of minutes with the doors open, and we can be back in service instead of having to wipe down every single surface and taking the risk of missing things. Not only that, but when you're down cleaning something, you're splattering and you have a risk of contamination. So these foggers, you stick it in there, you spray it around, you walk away, and your truck's done. So we're looking into that. I found them as low as around $250, $300 per unit. I'll probably look at getting one for each station, and the chemicals are cheap to put in them. So we're working on that. I don't have any hard numbers for you tonight, but just want to let you know. We are looking at ways to mitigate inspecting our crews. We've been really lucky. We're fully staffed right now. Every day I report out to the task force that any issues we're having. And I'm happy to say that we really haven't had our crew's in good health and good spirits. We're doing a lot to prepare for this. It's a lot to deal with. I think the hardest part for many of them was having to shave some of their beards so that their masks fit right. So, so far so good. We're doing really well in that respect. Let's see. I also attached your, it's the top page here, so that if anybody asks, as we're going into a lot of different places, they want to know that we're there to help and not to hurt. So they want to know that we're screening, especially the nursing homes are being, as you can imagine, very cautious about letting us in. So I attached a copy for you gentlemen to see what we're doing to mitigate those exposure risks. We've asked nursing homes to bring the patients to the front if possible, if safely possible. If not, they'll be probably closing all the doors and getting us back to patient with as little exposure as possible. However, that doesn't necessarily cover us. So what we're doing, we're logging 2 times a day temperature checks for all of our staff, administrative staff, everybody getting their temperature checked twice a day. And then we're doing a self-reporting questionnaire type thing to where everybody's heard these questions. Have you traveled? Do you have any symptoms? do you know anybody or have you had direct contact with anybody with COVID or that's quarantined or isolated? So they're the standard questions. And that is pretty much it as far as procedures. An update in the news every day, besides COVID, the next thing you hear is personal protective equipment. Where we stand on that right now, I would like to be able to use it on every single patient, but the fact is with the national shortages, we can't. So we have to be very selective about how we use it on ourselves. We can use some of these N95 masks that everybody's heard about. We can use them for up to 5 patient contacts as long as there's no obvious or gross contaminants to it. Basically, where we're at right now is about 2.5, 3 weeks supply. When we get down to 2 weeks, there's some triggers that we can request through the state, through MARC, Mid-America Regional Council, and other sources that might be able to get us some help. We've been able to stay about 3 weeks ahead. You'll see some additional supplies. If you looked at the bills, we did spend some extra money this month, kind of getting some things built up a little bit as a reserve. Medications that we've already had known shortages on, those have actually been improved a little bit. But PPE is like gold, so we're trying to keep an eye on price gouging, anything like that, which is now illegal, thankfully. But it's still happening, We've got volunteers out there looking to make cloth masks for us that can be worn over our N95s to extend the life of them a little bit. So the community, the county, the state, the nation is really pulling together really well for us. If you listen to the news, you'd think the sky is falling, but I just want to say that emergency services, healthcare, all of us are really working together as a team, and it's been just amazing to see how well it's working. I mean, I wish we were better prepared, but the people that are in charge of it in this county, in our area, I think are doing a very good job of getting us exactly where we need to be. Again, Dr. Gus might want to speak to when this is expected to get worse. I don't think it's going to get better anytime soon, but we are doing our best, as well as I think everybody else is doing an amazing job of doing that. So that is all I have tonight for the report. As you know, it's the second, so I don't have March's numbers, but if you've got any questions, be glad to answer.
Mr. Brown has
I
some.
do. Those foggers that you're talking about, do they work on you guys?
Yes, we can use, well, not us personally.
That's what I meant.
that.
That's what I meant personally.
Yeah, personally, the cup guns, they're putting isopropyl alcohol in them and using them as a mist. Now, if you've ever painted, you put a fine mist nozzle on there and you can do it. You got to put a mask on, otherwise you'd be drunk afterwards. But yes, they can work on us, and they can also work at the stations, which is really nice.
Well, I was watching TV and I seen Overland Park had some kind of a unit, they said, in each ambulance that did what you're talking about. But what you're talking about seems to me like more logical.
Yeah, there are some units, it's an option on the units that we, on ARV, and most of the manufacturers, not all of them, offer some sort of UV filter that comes through a HEPA filter, and then it's exposed to UV light and circulates through the ambulance. And those are great, but they're just for the ambulance.
Yeah, but those foggers you've got, or you're looking at,
You can put them in.
would work anywhere.
Yep, right here, anywhere in the station, all the ambulances.
And how many of those would you need?
I think one for each station would be a really good idea.
Yeah.
So the availability, cost, they go the sky's the limit on cost. About the cheapest ones I found are around $300.
Well, in my opinion, we're in a situation, none of us know what to do. I think you guys need something, and I don't know what it would be, but that sounds better than what I was seeing on television.
I can thank Dr. Gustafson for that. He has another service. Who was it? Fort Osage?
Yeah, Fort Osage.
I actually called their assistant chief and got some just really good information. So crowdsourcing has been very helpful too. Like I said, all these organizations are really coming together and give everybody's got their best ideas forward.
So are you coming up with a proposal for these, or,
yes,
or have you done that? Or
if I can get them for that price, it falls within my spending limit, and I was just planning on getting them. But once we buy all the chemicals, it might go over the $1,000. And in that case, I'll probably just put out an email if that suits the board for board approval to get those, or some variants there.
well, I think you need.
I appreciate it.
I think that's a neat thing. I'm telling
It'd be
you.
a good tool to have. Yes, sir. So if anybody needs that Nixle number, I do have that here.
Jumped out at me, this was back in the bills, but a turnkey mobile docking station for Tahoe, what? It was almost $600. I was just curious. I thought maybe you would know rather than.
Yeah, that is, Ryan, are you listening, or are you just watching, making sure everything's working? I believe that's the actual docking station for the computers.
Yeah, how much was it?
$600.
Yes, that's what they're on.
And the Tahoe is which vehicle? Who's driving
That
that?
would be the.
Roy.
That'd be
The new one we bought. Okay, thank you.
Yes.
Thank you.
Are there any other questions? Thank you. Medical Director's report.
It's been an interesting 2 weeks. Things have changed pretty much almost daily, and have had phone or text or email conversations with Eric and almost every day. And we're learning as we go on this situation. And what we're trying to do on a daily basis is just make sure that our folks are safe. I just yesterday, there was some information that came out about EMS folks not intubating a patient in the field. That procedure, you have to get down too close to the patient's face, and there's a lot of exhaled air, and sometimes more than that, when they're right down there, almost face to face with the patient. So we're putting things in place to make sure that if we do have to intubate a patient, it is a last resort, and we'll let the hospital do it with the proper gowns and hoods so that our folks aren't exposed. Also information that came out this week was that they're expecting the peak for Missouri to occur in mid-May. So that means we're going to see increasing numbers over the next 6 weeks. And that means that we're going to be in contact with patients that have not yet been diagnosed, but yet, as he mentioned earlier, are shedding virus that our personnel are going to be exposed to. So we just have to be super cautious. We can't take anything for granted. We might get called to a scene for a sprained ankle or a motor vehicle crash or any number of other things than a respiratory call. And we just have to assume that that patient might be COVID positive. As he mentioned, the personal protective equipment, or PPE as it's called, there's been some supreme shortages across the country. But I will have to say that the Bureau of EMS, the Department of Health and Senior Services, and the SEMA, which is the State Emergency Management Agency, are doing pretty much everything they can to try to distribute this material equitably to services around the state. A service might put in an order for 1,500 masks, and they might get 900, so that other services can try to stay up to par levels that they're going to need. And as soon as they become available, then they are shipping the rest, the rest of a service's order to them. So it's really been a challenge from top to bottom in the entire state. There's not one ambulance service that hasn't been affected by this, and we just hope that we can keep everybody protected and minimize like within the first week, St. Louis, like within days, they had 25 firefighters out of service. And, that's just not sustainable. And we have to come up with valid mechanisms to make sure that we're letting people work, but not putting others at risk. And that's just almost a day-to-day chore. So do any of you have any specific questions about COVID-19 or our operation or our plan? Okay, that's it for me then.
Thank you.
Okay, thank you.
Good to see you guys.
Yeah, good to see you too. Now we're off to another meeting. Well, we have a few minutes.
You guys may have to shave your beards before this is over. I don't know.
Committee reports, since everything going on, there has not been any strategic planning meetings. So move on to unfinished business. Medical billing services, proposal acceptance.
On page 36, I think you have my matrix there. Let me pull it up here. So we had lots of really good proposals for billing. As you can see, the top two that we received were Image Trend and then EMS MC. EMS Management is how I have it listed on here. I did this, it's been a couple weeks ago when I did this. I went through all the bids again today. I spoke to one of the billing experts at PWW yesterday just for a little guidance on, picking between two good choices. I had rated Image Trend a little bit higher due to their higher average net collections, but that's a number that's going to vary. It's going to depend on what, the biggest part of that's going to be what our patients pay. So, that's hard to judge a billing company off of what your patients pay. So, it's a really hard decision. It was 3.8 versus 3.75 as far as my ratings went. When I went back and looked at the details today again and went back through all the pros and cons, the EMS MCs, I had a lot more pros than cons on theirs. They have a really impressive staff training piece. It's an online portal that allows all of our staff to have training 24/7 anytime they need it on documentation. They have an insurance discovery process. So if we have a patient that we don't know if they have insurance or not, they can look for that. They have an online survey tool. Actually, both of them do have an online survey tool that our patients can tell us how they're doing, how the crews are doing, what they did well, what they didn't do well. So we can have an idea of what the patients feel like their care is. They also have online portals for patients to pay bills. Both of them actually have that. EMS MC, they have a crew analysis report, which tells us how the crews are doing on their documentation. It tracks things like patient signatures, crew signatures. There's just a lot of things that are on there that we can track. We could track them now, but it would take a lot of time for us to do that. They have experience in Missouri. All of their references took time during this pandemic to email me how great they were. I think that says a lot about how they feel about their billing company if they've got the time or take the time, make the time to tell somebody else how great they are. during this time. And the biggest three that they gave us as references were all Missouri companies. Image Trend didn't have any Missouri companies listed as their references, and they don't have any current companies that they do billing for in Missouri. Now there's Missouri EMS services that use their billing software, but they don't actually do the billing. EMSMC was the most detailed proposal. I think it was 174 pages. So as you can see, it took a lot of time to go through all these proposals. They work with PWW, which PWW is the one that does the certified ambulance coder, certified ambulance privacy officer, certified ambulance compliance officer, all of those certifications. They're the ones that do that. They work with them every year to have an external audit. They also have a SOC audit, which is an audit of their internal controls. They also have a lockbox process that's included in their price. Any of you guys that have ever dealt with a lockbox, that's a pretty expensive endeavor. And it would save me a lot of time, especially right now while I'm social distancing. I'm going to have to come in and do a deposit. But if we had a lockbox, that would have already been done at the bank. Images made, scanned to me, done. Really, I didn't have any cons, anything that was bad that I didn't like about EMSMC, other than it is not directly integrated into our software. It is integrated, but it's not. Billing, Bridge, and Image Trend are the same software company. So they are bi-directional. Everything that's in one is in the other. That's the only downfall that they have. On Image Trend, that is their one big plus, is they do have that bi-directional that we can log in and see everything from an EPCR to the billing to the insurance, what's happened all in one place. And they're our software experts. They know everything about our EPCR. They know everything about Billing Bridge. So if there's something that they're not getting from our EPCR, they know how to tell us to get it. Go look and see what else I had there. And again, Image Trend, their collection percentages were amazing. I mean, the ones they gave me were 98%, 92%, and they're all above 90%. And when I talked to the references, they said, yep, that's what we're getting. So it wasn't just they did creative math to get where they wanted to be. They're actually getting that percentage.
Why do you suppose that is, Jamie?
I'm guessing that it is got to do with their tenacity, their follow-up, their insurance discovery, you know, that they are willing to work with the patients to figure out how we can make this work. Eric, did you have a chance to look at anything that you wanted to add anything?
I did kind of look at what you had talked about as the kind of defining differences between the two. The lockbox, I think, is a big thing that takes a significant portion of Jamie's time, you know, a little tiny bit of mine, but by and large, that to me was a huge sale point. The percentage, Jamie and I talked about the difference in savings at the 4.5% of EMSMC versus the 5% versus by Image Trend. It's hard to anticipate whether or not that would be made up in the increased revenue or not. Like she said, that people are going to pay what they're going to pay, so I don't know if there's any way to anticipate that. The lockbox charges, the use of technology, initially, kind of like Jamie, I heard all this stuff and I thought, well, it seemed to make more sense with Image Trend as they were truly incorporated into our billing software. However, some of the other services, their Spanish language services they have, not just Spanish, but language support services for any customers that might have to call out SMC, yeah, so, yeah, Jamie's done a lot of the legwork, so all credit is due to her on this, but yeah, I didn't really have anything to add other than, initially I had some reservations about the software integration. From what Jamie has told me, she has found out, and from what I looked at online, I don't have those reservations anymore.
So what's that going to cost us to have the updated software and lockbox thing?
The initial setup fees,
There isn't any. It's 4.5% of our collections, and currently we're paying 5% of collections.
yeah, we don't have to buy any additional software. All the software is on there, and we'd be able to log into it pretty much, not necessarily in real time, but how often is that updated, Jamie? I'm trying to remember.
It is real time. It's like the EPCRs update every 10 minutes or 5 minutes or whatever. I mean, I'm not going to have time to check every 5 minutes to see if they're updating it, but
Right.
But yeah, it's pretty much real time when things are happening. You can see all the way down to invoice detail on their portal. And everybody said they're really good to work with you if there's a report that's not there that you need. In the amount of, they gave us a test portal that was just, made up data, but the amount of graphs and figures and surveys and just the amount of data that we could get just far exceeds what we've ever had. What other questions do you guys have?
The difference, I think you told me this already, the difference between a 4.5 and 5 equates to about 15,000 a year. Is that right?
Based on what we collected last year, it's about $15,000. Yeah.
Mr. Meehan has a question.
Mrs. Blueberry, I'm on page 36, I'm sorry.
And I don't have page numbers, so.
Okay.
Okay, yeah, I'm on the same page as you. I got it.
Yeah, it's got the green box on it. Right?
Yep.
Okay.
Mm-hmm.
When I guess I don't know the matrix that went behind the average net collection, but would it have an effect of how much the district was charging for the ambulance ride versus how much is actually paid? An example of that would be one ambulance district is charging $1,200 for the ride, and the next one's only charging $800, and we get Medicare at $450. So the collection rate on that particular one is going to be higher because of the lower charge for the ride. Is that a piece of this, or am I pulling too much out of it?
So yes and no. So this is the net collection percentages. So net collections is what you billed less your contractual write-offs. So for Medicare, the difference between that 1,200 and 400, that gets taken out completely. So you would have 100% collections on the example you just gave.
I see. Okay, so it would be the full amount. Okay, that's a part of that matrix that I didn't understand.
Yeah, and I mean, the matrix is it's right there. It's the weight that we had in the RFP. So qualifications was 10%, ability to comply with the scope was 10%, price was 25%. So, I mean, I just did the rating scale 0 to 5 where they fit in there. So.
Right, and I was not questioning that at all. I was referring to
okay.
The matrix behind calculating the average collection rate.
Yes. Okay. I'm sorry.
Yeah, the rest of that was great. Now, on the back side of that page was how we scored them, and one of them was one of the pieces on each one of them reference checks. Did we call these their references and get a feel for, or was it just in the packet of that the information was available from these other agencies that was using it and they had positive responses?
Now, I called 3 references on every one of them, except for our current billing company, because we know what what our experience has been there. But I called or emailed because when it got to be a little bit dicier with the pandemic, I just started sending emails because I didn't want to take people's time if they didn't have it. So I just emailed them. So the last few were just emails. But yeah, no, I got actual responses from people that are using the software, using the companies.
Are there any other questions? So I would take a motion to approve.
Mr. Chairman, did we get a recommendation from Mrs. Lubrine and our chief, or I listened to all that, it seems like they were struggling with which one out of the two. So that would be my question back to Mrs. Lubrine, which one she is actually heavier.
Yeah, it is a very hard decision because they are both very good proposals. But based on the references and talking to PWW about, different things to look at, EMS MC would be my recommendation.
EMS, MGT,
MC.
Yeah, I have EMS management on there, but their official name is EMS MC.
Yes, here, John.
I'll second that.
Second.
I'll second Jamie's.
Because we wanted both of your inputs.
Yes.
I don't have any other questions.
So do we have a motion?
I'll make the motion that we go with the recommendation of EMS MC as our new medical billing service.
I'll second.
Any discussion? If not, all in favor say aye.
Aye.
All opposed, same sign.
Can I ask a follow-up question? When would it take effect, or do we have a date, or is that just hasn't been decided yet?
We need to send our current, according to our current contract, we need to send them a letter with 90 days notice, which I believe she has prepared.
Yeah, I have a letter prepared, and 90 days from today is July 1st.
Medical billing collections.
So this one was really easy. We only got one proposal. So either we accept that or we put it back out for bid. The proposal we got was from Viking Collections. They actually work with Image Trend pretty closely. Let me pull up that proposal here. I did not call their references. Their references are places like Kohl's and some other air services. So I really just wanted to see what you guys wanted to do. I mean, it's the only one we have. It's the only proposal we received.
Why do you think we only got the one? That was kind of surprising to me.
I don't know. I mean, it was all put out at the same time. The billing and the collections were all put at the same time, and we got 5 responses for billing and 1 for collections.
Mr. Chairman, we looked at, Mrs. Lubrine, some information about a collection agency. Is that not the same one?
That's not the same one. No, that one was a more local one. That was Frank Flashpolar. He works with Frank Foster.
And they decided, I'm sorry, I'm jumping in there, but they decided not to bid, or we just hadn't heard?
We haven't heard from them. I mean, they had given us a proposal prior to us bidding it out, but we'd never received anything through our official RFP process. And I did send it to them directly, so.
Actually reached out to Frank Foster as well, and passed along that we were, that was out there, so we did to make sure they knew about the RFP.
So how do you perceive that? They're not interested?
Maybe they thought they couldn't meet our requirements. I'm not sure. I mean, It looked like they were pretty standard, I thought, requirements, but maybe they thought they couldn't meet those. I don't know. I mean, like I said, I haven't spoke to him since he gave us that first bit of information.
The one that submitted though did meet the requirements.
Yes, yes.
So what is your recommendation? To accept the one bid?
If you guys don't want to put it out for bid again, that's our only option.
How much, Jamie, do you know how much right now, how much effort, time, and energy, and how much dollar figure of the accounts were actually being worked in collections currently?
I don't know what's being worked. I mean, I know how much they have, and I know we get not very much of that. The proposal here is 33% of gross dollars collected. I think we're paying 30% now, plus fees. So, just looking at the proposal again. This company has,
And the proposal again, let me get this straight, is on what accounts going forward will they collect on?
so any delinquent accounts that we turned over to them, so they'd be at least 120 days old.
Okay.
With no action. We haven't received a payment. We haven't received a phone call. We haven't received anything.
Is that proposal in the packet?
No, it's not.
Okay.
I don't know if you have one there, Eric.
No,
I can email that out to everyone if you guys want to take a look at it.
Mr. Chairman, I would be hesitant about accepting a proposal that I haven't really looked at yet, so it wasn't in the board pack. And then the next thing is that since we're going with this EMSMC, do they have a collection?
They didn't indicate they had a relationship with a collection company. When I asked them about it, they said everybody just chooses their own that they work with. So. Do you guys want to just table this one, take a look at it? Because we.
the last board package, Jamie.
The last board meeting is when we got those. Yeah, they're just.
Okay.
And currently we actually don't have a contract with our current bill or not billing, I'm sorry, collection agency. The contract we have is actually between NBC and the collection agency. So, I don't think we have any sort of 90-day window that we need to look at on that one.
So I mean, NBC is not actually the one actually collecting on our
No.
current accounts. So
No.
we don't know who's collecting on our current accounts, so that just, I mean.
No, it's Kansas. I know who it is. It's Kansas counselors, but.
Correct, we know who it is. I mean, we haven't received or know any knowledge of their reputation, their references, anything of nature of their type of way they're doing business. Is this going to mess anything up as far as the transfer over from pulling everything out of NBC? As far as notification?
No, because we actually decide when things go to collections.
Okay.
So, I mean, if we decide we want to send the next ones to somebody else, I think we just have to tell NBC that's where we want them to go.
And correct me if I'm wrong, all these accounts do not have to go to the same collection agency, do they?
Not to my knowledge, no.
All right. Mr. Chairman, I asked that we table decision on collection, awarding of a collection service.
We'll table that and then we'll put that in our next board packet with maybe a breakdown. Annual renewal of the mowing bid.
Looking for the right page number. Can somebody help me out with the page number? I have it. It's just I know it's in a different order.
The summary is on 24.
Okay, so that's the one that the PCAD 2020 mowing bids.
Yep.
So in looking at those bids, Greg Werman's bid was $100 for TT Highway and $125 for 16th Street, every other week up to every 10 days in peak season. Dakota's Lawn Care was TT Highway was $60 and 16th Street was $120, but they didn't provide a schedule as we asked for in the RFP. And then Foster was $125 at TT Highway and $280 each mowing at 16th Street. That included, in their proposal, they had weekly for TT Highway and 16th Street, add $80 to change that to every other week. So it was $200 and for every week. And then if you changed it to every other week, it was $280. So $280 is what I have here, to keep it kind of similar to what Werman bid. And looking at those, Werman's bid is the least expensive.
Greg Worm was the one that mowed last year.
He is. He's the one that mowed at 16th Street last year, not TT.
His actual bid is on that page 25.
I don't know, why did we split those up last year?
Cost.
Okay.
Are there any questions? And your recommendation would be Werman's?
Yes. I don't. We didn't have any problems with that last year, did we, Eric?
No.
I didn't think so.
Yeah, not all, they kept it looking good out there.
We have a motion to accept Greg Werman's bid. Do we have a second?
I'll say.
Any discussion? All in favor, say aye. Aye. All opposed, same sign. Ambulance leasing and extended warranty.
You guys hear me okay? Okay, so you guys had asked about a month ago, maybe a little bit longer than that, about ambulance leasing. And this is just some information for you guys to look over. Ask any questions. It's basically, the long and the short of it is financing for an ambulance is what it boils down to. There's not the standard leasing type of situation like you would find in a vehicle or a I don't know, semis do leasing as well, but this kind of is a lot different. This is basically what's available to us. It also asked on it. I know this isn't on the agenda, but you'd asked about extended warranty. So what I've found so far, and I hope I've not been able to get any documentation on it, is $7,500 for an extended warranty that will go up to 200,000 miles. So that's what I know so far. The thing about that is most of our major issues have occurred over the 200,000 mile mark. So I would be cautious of that, or at least cognizant of it. But that's the information I have. The numbers you see on page 20 and 20, 21, and 22 is basically based off of what this next ambulance we've ordered is going to cost, just to give you an idea of what payments would look like. So like I said, it's just information for you guys to look at. Feel free to ask questions. I'll do my best to answer. That's what I got for you.
Are there any questions?
Well, I do.
Okay.
This extended warranty thing, you say everything's happening after 200,000 miles.
Yes.
Okay. And extended warranty for that would be the $7,500.
To go from 150 to 200,000.
So it really doesn't benefit you any to, buy the thing and.
I mean, I think there's a piece of it that could. I mean, just because this has always been this way doesn't mean it's always going to be. And when you think about $9,300 for a motor versus a $7,500 for an extended warranty, and the motor goes out at $179,000. I mean, it'll be great. But if it goes out at $201,000, then we've spent $7,500 and we didn't really need to. So I mean, that's the way I kind of look at it. But I mean, it's basically an added insurance policy that covers the ambulance up to 100 or 200,000 miles. So if there is major malfunctions at 150,000, then we've got some leeway that will, or something in place to help us take care of the issue. So we're not putting out all the money for a new rear end, a new transmission, a new motor, or whatever may happen up to that 200,000 mile mark.
I don't know that it's money spent. I mean, really, I've just never seen so many rear ends and transmissions and motors. I mean, I've got a fleet of trucks. We don't have, I understand the difference too, jump in it and go and whatever, but it just seems to me like that's an excessive amount.
Yeah, and I agree with you. The thing that we don't think about is when we're sleeping and you're not at work, all those vehicles are still working.
I know.
It's the hours.
I know.
It's the hours.
So I think you're probably doing the best you can. I just wanted to know the difference there.
Well, I think, with our discussions in previous meetings, about trying to get that to where we're getting these ambulances out of here at an earlier time, at a lower mileage, I think you're going to see an offset. I think that's going to go away as far as,
I agree.
we just got some catching up to do, as far as getting rid of some of the old fleet that we have.
Roy, I appreciate your investment and time in getting us this information.
Are there any other questions for?
On average, when do we change the box?
Every 4 to 5, probably every 4 is it rotations?
You mean buy a new box,
Well,
as far as how many remounts we'll get?
Right.
With the ARVs, I think we're anticipating 2 remounts at best. There's a possibility of 3, but after 2, you start with a lot of other issues. We haven't remounted yet.
So we've yet to remount the ARV.
Correct.
Okay.
So that
pay the extra insurance.
I'm sorry, what?
I was thinking the cost of the lease with the extended warranty. Do they remount the boxes now?
On a lease, and Roy, you might have to correct me if I'm wrong here, but on a lease, you're not remounts. Roy, you still there?
Yeah, I'm here. I'm trying to listen to what you're saying.
Yeah, I don't believe, a lease is just a whole new ambulance, including a box. It's not a remount.
Right. So if you go with the lease, if you guys were to choose to go to lease route, basically it would be for a whole new truck. There wouldn't be any leasing for a remount. Now on some of these, with one of these, there's a buyback option at the end of the lease where we can buy it back from them. And at that point we could look into doing the remount. But if you're going to go the lease route, it's got to be a whole new truck and box.
And what's the remounts around?
Remounts usually run about 130 to 140,000, roughly. A lot of times it depends on the condition of the box and what needs to be repaired and replaced when it goes to the factory for remount.
When do you think we'll do the first remount, Roy?
I mean, it's hard to say. We got a fleet of about 5 trucks we gotta get rid of before we can even think about remounting the truck yet. But I mean, it's going to depend on mileage too. I mean, if we start getting these newer trucks with higher mileage on it, we're going to have to look at figuring that out and slowing the process of getting rid of the old trucks and start remounting the newer trucks. So that way we can, we don't have that. We keep from having these newer trucks getting in the 160, 170, 200,000 mile range.
Any other questions? If not, we'll move on to new business. There are announcements. There was an emergency vote taken last week by email to approve the paying of the bills and the workers' compensation renewal, just to stay current in a timely manner. And also one other announcement, Greg Nearing has turned in his letter of resignation. And that being said, we could appoint Mr. Buckley at our next meeting to fill out the remainder of Greg's term, be that till June 2nd or whenever. And he will be the natural.
I'll make a motion, we accept Mr. Nearing's resignation.
We don't need action on it. And also at the next meeting, if we so wish, we could go ahead and elect officers. Because by our bylaws, that is by first meeting in April was when we're doing that. If there are no other.
This was in the packet. Mrs. Wolverine, this was in the packet. IGT requirements for GEMT reimbursement. It's just a simple question. This was from Myers and Stauffer CPAs.
Correct.
What's our relationship with them?
They are the CPA firm that the state has hired to audit all of the GEMT.
Okay.
So technically we have no relationship, but that's why they sent that.
Okay, well, that's the first time that I've seen their name, and so that just kind of threw me curve. I understand.
Any other questions? If not, we'll take a short recess before we go to closed session.
Well, I can't not touch my face, especially when I think about it. I got itch here and itch here.
It's consumed my life.
And I hate to say it, the first thing I thought of was that trailer that we had with all,
Oh, the RV thing?
with all the
Yeah.
stuff in it.
Yeah, I set that up at the Johnson County. I set up the EOC up there. I don't know, how many cases are in Johnson County, they're a little ahead of us, but I do think that we did been doing more testing up there. Yeah. That probably includes some testing on Black Hole as well, so.
The strange thing about it is you can go to the Johnson County, Missouri Health Department website, and they'll tell you how many tests have been conducted, how many came back negative, how many were positive. Dennis County can't tell you how many tests have been done in this county. Have no clue. Not a clue. And then we'll all find out when they get sent back from the lab. That's the requirement time that they have to notify. Just
I'm hesitant to speak to testing because it is not my wheelhouse. And, but I will say that initially the state labs were overran, so they started sending tests to private labs. Private labs were overran, so people are sending stuff back to state labs. So states got a better turnaround time too. Now,
change.
So if they're saying this thing's gonna peak mid-May, goodness gracious,
In our area.
we've got,
Month and a half.
oh, I'm telling you what, that's,
I don't understand what the whole lines of cars were with people being tested. If you're not sick, stay home.
Well, to get in those drive-through tests, it's my understanding, you have to contact your physician. And your physician has to order that test. It has to be ordered by, I believe it's a physician at this point. They might extend that out to include other people. But you can't just drive through and get a test. You actually have to.
You've got to still have to have symptoms.
Yes, you gotta have some reason that you're being sent there to test. The benefit is you don't get out of your car, you don't expose other health workers and so forth. I know that Bothwell and the health department have looked and are currently looking at the means to do mass testing if needed. But we're just not there yet. We're just not there yet. So we might be there Saturday. I don't know about the way this thing grows exponentially. You know, it's right. You know, some days it doubles, some days it doubles in 2 days, some days it doubles in 3 days. But
Well, it's like we train all the time for hazmat incidences. But not these.
well, the most significant thing in my mind right now is it's the age groups. It's not, you know, initially when this came out, they talked about nursing home folks and the elderly and those comorbidities like cardiovascular disease, strokes, heart attacks, diabetics. Those are the top 2 slots, and then other things, hypertension and so forth. So we probably, I know I can check a couple of those, I'm sure.
thing of it, nobody knows.
Yeah,
They're adding these things just as,
but it's getting young people.
yeah.
I saw a CT scan of a guy who's around 30 years old the other day. And it looked like his lung looked like they were full of jellyfish. This is a young, very healthy athlete. Just, you know, it's right.
Well, Cheryl said something she listens to there. It's not like, you know,
I saw you on TV.
it's not like pneumonia. It
It's
actually
famous,
has
Roy's famous.
scar tissue that
Yeah.
you don't recover.
A lot of the x-rays look a lot. If you've ever heard.
Oh, your insurance? Okay.
Cystic fibrosis.
You're all over. Well, I think is that.
Last sharp looking x-ray. Yeah, it's terrible.
So, there's every room in county. I mean, there's so much. You never know, you don't know what to believe, and like this evening now, we heard that tomorrow they're going to announce statewide, non-essential, stay home. I mean, I don't know if that's right or not.
Unfortunately, there's still some silos of information where it doesn't get shared really well. I always tell everybody the safe bet is look at your local TV stations, out of Jeff City, Columbia, Kansas City.
And see, they've already done that too.
And the governor's office has been pretty good. The local health department tries to keep up, but as you can imagine, they have their hands full with a lot of other things. So far, the best resources I've found are CDC.
That's pretty
CDC is
obvious.
gonna be a couple days behind on everything as far as they're closing down,
It's obvious people are gonna have to stay home, stop this.
Yeah.
I mean,
it's been done a little slapdash.
this is stuff like you see on TV. It's,
If we'd have just done it and got it over with, it would have been better. It's been tough already. A lot of people call me, they're talking today, Bothwell is briefing today. They have daily briefings and they're attending webinars. Apparently, there's a lot of new small business stuff coming open, available for people 0 to 50 or 0 to 500 employees, or 1 to 500 employees. Bothwell, unfortunately, it's 1,000, but there's some other stuff becoming available for them. There is a whole lot of help out there for small business. It's been released here in the past few days.
there is that, I mean, but
It's our money.
it's,
You gotta pay that, so.
Cheryl Taylor made a bunch of masks the other day.
What's that?
Cheryl and Tara made a bunch of masks.
Oh, did they?
Yeah, they, I
A
don't know.
lot of the churches have really been.
But do you guys need any masks?
We've got somebody who's looking to ask us today, in fact, what we needed, and I told him how many staff we have. And the nice thing about those is they can be longer.
That's what I mean.
They can be longer at work and going over our other stuff, but even then, at the rate we see, at the rate of our patient contacts, we're gonna get past that 8-hour mark, we're gonna get past that 5 patient mark pretty quick. So, I
How many
still,
we got?
we've got 40, quote me on this exactly, but it's basically 70, that includes all of our PRN staff. Around 40 full-time and remainder administrative staff. And, but you know, back on it, everybody wants to have a lot of masks. And,
I think that's a typo.
tied and good, that's what you do. And if you do a good job putting it on, right, they'll last, you know. And the good thing is they're reusable. But, where most people are using, where the CDC's recommending those are used right now is over the N95s.
That's one time, yeah.
We'll go ahead and bring the meeting back to order, and I'll take a motion to go into closed session pursuant of RSMo 610.021, sections 1, 2, 9, and 21. Do we have a second? All in favor? It's roll call.
Mr. Ryan,
Yes.
Mr. Fritz,
Yes.
Mr. Gerby? Yes. Mr. Lee?
Yes.
Mr. Meehan?
Yes.
We will stop the live stream as we go into closed session.
For those of you viewing, we'll be stopping live stream. It will return once we exit the closed meeting and come back into open to close the complete meeting. So soon back in.